All right, let's talk about further divisions. So here we are going to talk about dividing up the abdomen. So the abdomen can be divided up a couple of different ways. One way in specific is referred to as the quadrant system. Now the quadrant system is the most commonly used division system because it's nice and easy and simple to remember. You simply make a plus sign, drop it the cross point at the belly button, and there you have it. It divides the abdomen into the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. Hopefully you remember those abbreviations from midterm, because this is really where they come into play. But here we have some imaging of that and showing what can be found in each of these spaces. Now we are going to move from here straight into some imaging here. So, microscopic anatomy. Things we cannot see with our naked eye. How do we see them then? Well, that's going to be done through microscopy. Two different ways. The one you will use the most commonly, frequently, in any of your labs you do here in school, and if you work in a lab setting in a healthcare field or office, you're going to be doing light microscopy. It's the least expensive, most common, and gives you a ton of information. Electron microscopy, we love to see the images from that, but it is super expensive. This school does not have one, and in fact, many field schools do not have a electron microscope because they're so expensive. But they give you really detailed, really clear images of very small things. Here we have it, light microscope, and then the two different variations on electron microscopes, transmission and scanning. Now, depending upon what microscopic class you take, we will spend more time talking about the difference between transmission and scanning. Okay, I mentioned in labs, in a healthcare office, you will be using, potentially, again, depends on the healthcare setting, a light microscope. How would you use that? Well, we can prepare what we refer to as stains of the tissue samples that we have collected from our patient, a cheek scraping, a throat scraping swab, nose swab, and we can do various dye procedures to it. These dye procedures will allow various characteristics to become highlighted so that they are easy to see, or more easy to see. If we are using an acidic stain, this is going to have negatively charged dye particles. If we use basic stains, these are going to contain positively charged dye particles. There's also, so some of the most commonly referred to and used stains are things like an acid-fast stain and a gram stain. You may have heard of gram-negative or gram-positive bacteria. That comes from that dye procedure. All right. Scanning electron microscope, that's going to utilize a stain as well, and it can. This allows for, electrons to be deflected at various levels and splits. With any imaging, whether it's a microscope or an X-ray or CT or an MRI, we can get things called artifacts. And these artifacts are minor distortions in the tissue. Now, when we're talking microscopes, these are going to be minor distortions in the preserved tissue, maybe during that preserving process they shrunk or expanded or they twisted. It will basically not look quite like a living tissue and organ. When we're talking imaging artifacts, these tend to be things that don't belong. This could be a gas bubble. This could be a underwire, a button, bra clasp. All of these things can appear on imaging, and they're known as artifacts. A hair, depending on the type of imaging. All right, X-rays. They use electromagnetic short wavelengths. These are amazing, the best for visualizing bones and abnormally dense structures. This is why X-rays are usually the first technique, first image that is taken, especially if what we are dealing with is something that we suspect or we know is a dense object. Like I'm looking for a bone fracture. I'm not going to take an MRI. They're more expensive. They actually don't give as much detail as that X-ray will give me. So, X-rays, first mode. After I have my X-ray, then I can do other types of imaging depending on what I'm looking for. But this would be a chest X-ray, typically done to help determine if pneumonia has cleared up, if the patient truly does have tuberculosis because they tested positive on a PPD. And then with X-rays, we can do a variety of contrasts. This is a lower GI series. The patient drank barium, and now we snap pictures and watch that barium go through their GI. CTs, or computer tomographies, otherwise known as CAT scans. These are, think of them as more for soft tissue. They will allow us to see everything on the way through. Looks something like this. CTs can always be determined from MRIs because on CT, bone will be white. And the negative space, the air, so to speak, will be black. Angiographs, these are a contrast imaging that is done for blood vessels. Looks something like this. Positron emission tomography, otherwise known as PETs, these are going to use radioactive compounds to track through the body. Sonography is the fancy way of saying ultrasounds. We use high frequency sound waves and we record the echo back. This is what is done to help determine the age of a developing fetus, the gender. This can be done to determine if the spleen is enlarged, the liver is enlarged, the gallbladder is enlarged. It is a non-invasive procedure. It can also be done with the heart, actually. It's a non-invasive procedure. It does not increase your risk of radioactive waves. It's relatively inexpensive. So again, this is another first line of inquiry type imaging because it's easy, it's fast, it's cheap. This is a PET scan. This is an ultrasound. MRIs, these are for soft tissues, definitively. They help determine body tissues based on water content. So these are going to use magnetic resonance and look something like this. On MRIs, the bone is going to appear more blackish. And that's the end of our first PowerPoint.